CNN's chief medical correspondent, Dr. Sanjay Gupta, who joins us now live. Doctor, I appreciate you joining us. This is a big moment for the country and really for the world. Take us through it. What do you think of that?
Well, it is unsettling for sure. People who are hearing this for the first time, I was asleep, heard this news, and right away it sort of it gives you a jolt for sure. We wish obviously the president well. It sounds like reading that memorandum that he's doing well. It still doesn't say clearly whether or not he's had any symptoms or not. It says that he's convalescing along with First Lady, who's also been diagnosed at home. I think that we've known for some time that there is obviously a very contagious virus that is circulating. I think a lot of us in the medical world have been concerned, looking at the West Wing, looking at the White House, about their protocols. Small space, small quarters, lots of close contact, no sort of mask mandate in place. Even mask mandates that had been suggested had sort of been turned down. People say, well, the president and people around him are being tested on a regular basis. As I think people know by now, testing gives you the information after the fact. It's very important because then you can take people who have been tested positive, you can isolate them, and you can then trace their contacts and start quarantining people who've been in close. And that's going to be a very important policy here within the West Wing, within many quarters now, over the last several days, to see who does now need to be quarantined in addition. Again, not just in the West Wing, but in other places. Vice President Biden may have been far enough away on that stage, and I know that they came in from different areas, probably did not spend time that close together, but he's going to need to be tested as well. All the campaign staffers.
Can I ask you?
That's going to be critical.
Can I ask you about the current vice president? Because the current vice president, according to the information that I have, Vice President Mike Pence was not in close contact with Hope Hicks. That's when we knew that Hope Hicks had tested positive, before we knew about the president and the First Lady. But Pence is on camera saying that he was in the Oval Office with the president on Tuesday. So my question is, the vice president is possibly exposed at this point, and I'm sure people are wondering if Pence is going to be ready to do a debate with Kamala Harris on Wednesday if the current vice president has possibly been exposed to COVID. If he met with the president on Tuesday, what's the likelihood that he's exposed to or he's possibly positive?
Well, I think you'd have to treat people as potentially exposed at this point. I mean, there are criteria for this sort of thing. How close were they in contact? How long were they in contact? And this is the basic within 6 feet, longer than 15 minutes. But look, we have to be very, very cautious here. And keep in mind that people will say, well, I tested negative the next day after the exposure, therefore I am good to go. Mm-hmm. That is not the case. You could have an exposure today, test negative tomorrow, the next day, and so forth for several days, and then suddenly test positive, and it could be due to that exposure several days earlier. My point is you have to be very cautious here. And again, people will probably get specific and say, hey, look, the contact wasn't that long. They stood far enough apart from each other, but who knows? I mean, we're dealing with the leaders of the country here, and I think they have to be very, very careful. So, I'm sure there's lots of considerations going on right now. But if they were to be treated according to CDC guidelines, according to how other people would be treated, then the president, the first lady, anyone who is positive would clearly be isolated. One could have already made the argument that the president would have needed to be quarantined just on the fact that Hope Hicks had tested positive, but now clearly needs to be isolated, which is a term for someone who is positive. And then people who have had that contact, including the current vice president, may need to be quarantined, which is the term for people who aren't positive but are suspicious. And that would be following health protocols. But Don, I guess the point you're making, there's not been a lot of the basic public health protocols that have been followed in terms of masking and things like that already. Mm-hmm. So I'll be very curious to see how they carry this forth. I mean, they need to take this seriously.
Well, as I said, as I've been saying, there are so many unknowns at this moment. The president's doctor is saying, well, the president's going to carry out his duties without disruption while recovering. Well, we don't know that for sure yet. We'll have to see, how the president feels. if that is indeed part of the protocol of the government, because, at some point the vice president is supposed to take over if the president can't carry out his duties in any way, or if he's incapacitated. I'm not sure if the president will be incapacitated. It seems to, from the doctor's memorandum, that it indicates that the president is feeling okay. But my question is, as you said, there are so many unknowns. My question is, the former vice president, you believe that when they were on that stage just a couple of days ago, that they were far enough apart that the former Vice President Joe Biden should not be concerned? Or should he be concerned? Should he be tested?
He should absolutely be tested. There's no question about it. I mean, I know that they were following these protocols when they were doing this debate. I don't know exactly how far apart they were, and you got to keep in mind this is not an exact science here, Don.
But Sanjay, members of the president's family and his staff sat there in that debate with no masks. I think the first lady is the only one who wore a mask. I mean, come on.
Yeah, no, look, these events have been concerning to me from the start. I think this has always been about, let's see what we can get away with, right? I mean, whether it was that debate in terms of actually having people indoors for a period of time like that. There's data now on the fact that this virus, and by the way, people are wearing masks so that they don't put virus into the air, right? Mm-hmm. So when First Lady Melania Trump's wearing a mask, in part, really, when I think of that, I think that she's doing that to protect the people around her. May offer her some protection as well, but this is part of the whole debate on masks again.
Yeah,
she was wearing it to help protect people around her.
Yeah. Sanjay, I want you to...
The president may have already been exposed at that point. We don't know when he was exposed, and now he may just now be testing positive.
Stand by, Sanjay. I want to bring Caitlin Collins in. Caitlin, let me ask you this. This is an updated daily guidance and press schedule for Friday, October 2nd, 2020. This is from the White House. It is indicating here that at 10 a.m. the president is still going to have in-house pool call time. And at 12:15 p.m., the president hosts a call on COVID-19 support to vulnerable seniors. Now, he was supposed to go to Florida. He was supposed to do different events. That is not on this news schedule. It says closed press after the 12:15 event. But it seems like he's still going to try to get some work in tomorrow.
Yeah, and it'll be interesting to see if they continue to put things like that on the president's schedule moving forward. Notice it says it's closed press. There is a bit of irony that it is a call on COVID-19 support for vulnerable seniors. And that is the only thing that is going to remain on the president's schedule. And that reminds me of what's at the end of the doctor's letter from the president's physician that says he is going to continue to fulfill his presidential duties. But of course, the question is, what are those duties going to look like, and what happens if his staff is having to quarantine as well, given the fact that they have been around him? His chief of staff, Mark Meadows, is one of them who has been obviously constantly around the president as he was getting ready for the debate. But Don, he's also been on Capitol Hill with the Supreme Court nominee, Amy Coney Barrett. And I think we have a picture to show you just how many levels of power are going to be involved in this and may potentially have to quarantine. There you see it. Senate Majority Leader Mitch McConnell on the right, the Supreme Court nominee in the center, and then on the left, you see the president's three top aides, the Vice President Mike Pence, Mark Meadows, and the guy on the left in the red tie is the White House counsel, Pat Cipollone. These are all massive power players that have all been around the president and Hope Hicks, and now both of them have tested positive for coronavirus. So the question of what the power in Washington is going to look like over the next few weeks as we figure out how severe the president's diagnosis is going to be and how widespread this really is among his circle is just to be determined. We do not know the depth of it. We are going to have to wait to find out. That's something that we'll just have to learn in the coming days. But it's going to raise a lot of questions about the campaign as well and the future of that, because I heard Brian saying it's 13 days away is the next presidential debate. Obviously, that is shorter than the 14-day quarantine period that happens. There are still questions about how the president will be tested, when they will decide he's cleared from coronavirus, and really how the next 2 weeks look for him. If he does develop symptoms, if he does not to start to feel well, like his doctor says he does today. And that raises questions about about Joe Biden's campaign too, Don, and whether or not he's going to suspend his campaign. We're thinking back, someone much smarter than me pointed out tonight that back in 1912, when Teddy Roosevelt had been an assassination attempt, Woodrow Wilson suspended his campaign and waited for him to recover. So is this a situation like that, where the Biden campaign takes a step like that? Do they continue campaigning over the next few weeks, knowing that the president can't? We are in a critical time frame. It was already basically a pressure cooker inside the Trump campaign, and now this diagnosis is their worst nightmare, Don.
Yeah, and this is, listen, this is, again, so many unknowns. Sanjay, I'm going to ask you, because you're the doctor. You saw the photograph that Caitlin made us aware of. You see Mitch McConnell, you see Mark Meadows, you see the vice president, and you see Amy Coney Barrett, right? So she's there. The hearings are supposed to start. Are they going to have to be postponed now? Is she going to have to quarantine? Because the vice president, admittedly on camera, saying that he was in the Oval Office, he met with the president on Tuesday.
Yeah, I mean, so this is concerning. This is very concerning, obviously, and there's going to need to be significant contact tracing, a word that we don't talk about nearly enough because it's impossible really in this country to contact trace 40,000 people a day. But here you have a situation, and Caitlin's putting up this photograph where this is the kind of thing that people are going to look at and say, well, what were the various contacts now between people? Strictly speaking, we're really talking about the idea of quarantining people who've come in contact with someone with known COVID. Now, if Vice President Pence was in the Oval Office but does not have known COVID, then she may technically not need to be quarantined. I'm talking about Amy Coney Barrett now. But this is going to be a tangled web, and it's going to be challenging. And this is why you don't want to be doing these sorts of meetings indoors, close contact in the middle of a pandemic. I mean, nobody likes the situation that we're in right now, but that's one of the things that people had to have been cautious about. So it's going to, the vice president gets tested on a daily basis as well. So that's going to be something that they need to monitor very, very carefully. But there are specifics here. And again, it's not an exact science. But what is a contact? That's going to be really important. How close were you? Did you shake hands? Did you give a hug? Even a quick one. Were people wearing masks around? How long was the contact? Was it over 10 or 15 minutes? That's going to constitute a close contact. Was it indoors? We can see that it was indoors. They may even go back now, look at these buildings and say, well, what was the ventilation like in there? Was it poorly ventilated? Was the virus likely to aerosolize into that space? What about these spaces now, including the West Wing, the Oval Office? What sort of decontamination procedures have been ongoing? What are going to be ongoing now because of what we've just seen? So, and in the other buildings, like the picture that Caitlin is showing, those types of buildings, how are they going to be, disinfected? So all of that, I'm sure, are parts of the discussions. One thing I have to say is I hope that there is full transparency around this. Full transparency, not only in terms of who likely was exposed, but also on the symptoms that the president, the first lady, others may or may not be having, because that's going to be really, really critically important. I will say again, Don, it's unsettling, but still the odds are very much that the president will recover from this, that will be okay from this. He is far more likely than someone who is much younger to become sick. He's far more likely because of his pre-existing conditions of obesity and heart disease, but still, much greater than 90% chance of having a recovery from this.
Yeah, we certainly hope he does recover. Sanjay, I want you to stand by. Let's bring back in, Sanjay is going to stay with us. We'll bring back in Brian Stelter and Carl Bernstein. Brian, do you believe, because we waited for so long, right, to hear about the test. Do they sit on this? What happened?
Yeah, let's be honest, Don. You were on the air at midnight, 12:30 a.m. There was certainly a reasonable suspicion that the president had tested positive, and that the reason the White House didn't announce a result right away is because they knew he was testing positive, and they were providing notifications to people like Mitch McConnell and other leaders of the government. I think that's a fair assumption to make at this late hour. We know the White House has these 15-minute rapid tests, and it was concerning by 11 p.m. and midnight that we did not have an answer from the White House. And that gets to Sanjay's point about the need for transparency. White House aides who feel pressure to lie on behalf of the president, they should feel more pressure now from all of us in the public to tell the public the truth in the coming days and weeks. Boris Johnson, other world leaders have been sick with COVID. Boris Johnson, when it was in his 50s, he ended up in the ICU. He said, quote, "It could have gone either way." I think the point there is that we shouldn't assume the best or the worst. We don't know. As Sanjay said, the odds are in the president's favor, but there are other world leaders that have suffered mightily as a result of this disease. And one more note, Don, we've been talking about the Dow futures, the markets now down more than 500 points, the S&P, the NASDAQ down 2%. Just to give context for how the world is reacting to this, world markets are paying close attention to this concerning news.
Listen, Carl, the president says, or according to the doctor, well, actually, in his tweet, he said they're doing fine. We will get through this. The doctor said that they were doing fine and that they had the best people around the world. He wanted to thank them, and they will maintain a vigilant watch. And also, the first lady saying we're doing great. So at this point, it appears from them that they are doing well. We hope they continue to, but we know things can take a turn with COVID. Hope it doesn't, but we just don't know at this point. Again, I keep saying, and this is the God's honest truth, so many unknowns at this moment. We are in brand new territory here, Carl.
It's not just a question of brand new territory. There's also some old territory that we're somewhat hostage to, and that is the lack of transparency and lying by the president and this White House. And it's very significant, perhaps, that the White House physician, in his report, did not say anything about whether or not the president is experiencing or has experienced symptoms. And others in the White House are telling reporters that they too have not learned anything about whether or not the president is experiencing or has experienced symptoms. And we have to go back and look at the fact that this president has tried to hide his medical condition from us. He had that secret visit to Walter Reed Hospital that we still don't know what it was really about. One of the things that might result from this is that there might be some pressure from others on Capitol Hill, including some Republicans, to finally insist that there be some transparency for the good of the nation as we go through this period over the coming days. Because a lack of honest information as we go forward can be as crippling to the country as the virus itself can be to an individual. We really need, at this point, both the press to do its job vigorously, and at the same time, there has got to be some kind of change of attitude that is going to be forced upon the White House if we are to get through this period in the way that we need to, in an orderly and stable way.
I want
Don, briefly to the point about symptoms. I did listen to Trump on Hannity tonight. He sounded like his usual healthy self, for whatever that's worth. He wasn't coughing on the air. That is worth a little bit of information, at least to know.
Yeah.
He sounded like his usual self.
I watched it too, and I've watched as much as possible. Then I had to run up and do this show, I didn't hear live the part where he talked about this, but I heard where he denounced white supremacy and so on and so forth. And they talked about his performance. He's still saying that he thinks he did a great job. He doesn't want the debate commission to change the rules at all. But the question is, will the debate even go on? Yeah, the next one. Who knows, right? Yeah, but as we say in the news business.
The New York Times noted that he sounded raspy. They didn't attach particular significance to it, but his voice did sound raspy at the time. But we shouldn't speculate.
Let me read this to you, Carl. And I'm not ignoring you guys. So I want the viewers to know when I'm looking down, I'm checking notes because this is breaking news. And we all got our devices, and I'm getting stuff that's being printed for me here. The former vice president, the current vice president, Mike Pence, tweeting out tonight, Karen and I send our love and prayers to our dear friends, President Donald Trump and the FLOTUS Melania Trump. We join millions across America praying for their full and swift recovery. God bless you, President Trump, and our wonderful First Lady Melania. And there are also other folks who are responding, including a Democrat. As of this moment, Representative Ted Lieu of California says, I will keep the President and First Lady in my prayers, and I wish them a speedy recovery. And there are others as well. Let me see if I can get here and read some of them. The politicos who are tweeting right now. for the president. Sorry, I can't. If I can bring them up, I will. So people from all stripes, Democrats and Republicans, are praying for the president and sending. Senator Ben Cardin of Maryland says no person should have to suffer from COVID. To the Trump family and White House staff, Secret Service, I wish you good health and a speedy recovery. This virus doesn't care about where you live and who you support. Representative Dean Phillips also tweeting to the president and First Lady. Senator Martha McSally tweeting out as well their well wishes to the president and to the First Lady. Dr. Sanjay Gupta. So the president saying that they are in good spirits, they will get through this. And as you said, a 90% chance of recovery with COVID-19. But we do have to remember, and again, we hope that this does not happen to the president or anyone involved with this. But there are at least 207,000 people who have succumbed to coronavirus in this country. It is a very, very serious and dangerous virus.
Yeah, there's no question about it, and they have to take every precaution here, and I will say the chance of recovery is far greater than 90%, even if you account for the president's age, his pre-existing conditions. Even with that, that's something that sometimes gets lost in this discussion. But he is considered, to your point, far more vulnerable than someone who'd be much younger, someone who was healthier, had no other conditions. So this is something that the White House team and the medical team around the president, who are some of the best, obviously, in the country, are going to have to monitor very, very carefully. As you know, Don, there's no particular sort of cure for this. There are a couple of medications which are given to people, potentially given to people, depending on whether or not they have certain levels of symptoms. Remdesivir is one of them. Dexamethasone, a steroid, is one of them. As we know, hydroxychloroquine is not one of them. So there's not a lot of options here. So the biggest thing is going to be what they call symptomatic management. And again, we don't know. I read the letter again that you sent over to me, Don, in terms of the memorandum from the president. Still can't. I feel like they chose their words very carefully in this memorandum. Perhaps no surprise. Still can't tell. He's doing well, which sounds like he's doing well. Does he have any symptoms? Still, what is the answer to that question? Is something that I would like to, people should ask, and the White House should be transparent about. Fever, anything like that is might be an early symptom. But nevertheless, the symptomatic management means you're going to be treating the symptoms because we don't have a cure for the disease itself. And that's something that the president and perhaps the First Lady and anybody else who tests positive is going to be going through.
Does this change, Sanjay, any of the people who are the protocol, the people who come out and talk to us? Usually daily, the president does it, but the Dr. Birxes of the world, the Dr. Fauci's, Scott Atlas, who is going to take the lead on this? Does this even change anything? Because the president is still saying he's going to conduct the business, or that his doctor at least, he's going to continue to conduct business. And I would imagine that he's going to continue to conduct business in the same way that he has, with the same people in his ear, which is at least over the last couple of weeks has been Dr. Atlas.
Well, look, I hope not, because you do have some of the best and most knowledgeable infectious disease doctors in the world who are at the president's disposal. People that are considered the best in the world. So I hope that we're going to be hearing more from them. I mean, it's an interesting dichotomy here, Don, because in some ways, based on reporting, we've known that the president has been concerned about this for himself. He's known the severity of this disease going back to early February, right? So now that he has it, does it take on a whole new level of concern? Perhaps. But this isn't one of those, wow, this is a real thing, because back on February 7th, he was saying this is deadly. This can spread through the air. It's airborne. He was saying these things back on February 7th. He should have been implementing policies, even within his own ecosystem there, in terms of masking in the White House and all that, certainly advocating it for the country, trying to keep people as safe as possible. We know, Don, the statistics, maybe this isn't the time necessarily to remind people of that, but had we implemented some of those basic public health policies at the right time, at the time that we understood this disease, 80 to 90% of people probably wouldn't have died of this in the United States. So I hope now going forward that the same people that were providing that guidance that could have had such an impact will be providing the guidance. We'll be hearing from them on a regular basis. They're not going to be caring for the president. They're not his doctors in terms of providing his medical care, but in some ways they are the doctors for the country in terms of preventing problems for the millions of people who are still at risk of this disease.
Sanjay, you mentioned hydroxychloroquine. The president took it. It did not work. And listen, I don't mean to that in a I'm not being facetious, but it did not. It obviously does not work and did not work for him.
Yeah, I mean, it did not, and that's exactly what the evidence would have suggested. I mean, people aren't just making this stuff up. There was a theory on this medication. Maybe it'll work based on what we know of this medication. All right, go test it. Go test it. Go start doing testing.
Sanjay, let me ask you this. Let me ask you this, because we know it doesn't work, and I know you don't have to go through the whole explanation of it. Is this a moment of reckoning for the president and this administration, for all of the pretending or looking the other way, and trying to convince people otherwise of the science for whatever reason, whether it was to make sure that he was reelected, to make sure that he had high standing with the public, or just for whatever reason, because of the economy. Is this now a moment of reckoning that, yes, this is real. It is not a hoax. It doesn't care if you're a Democrat or a Republican. It is time to take this seriously and all the preventative measures that the scientists, the doctors like Dr. Fauci and Dr. Birx, have been touting for so long.
Well, Don, it's interesting. I would answer first as a doctor. Whenever I take care of patients who are now dealing with a disease that had only been conceptual in their mind for some time, yeah, I mean, people do behave differently after that. Whether it's heart disease or brain disease, or the patients I care for, they do treat things differently. There is a seriousness, where they may not, it does change your perspective. But Don, it's interesting. The president has known the seriousness of this disease for a long time. We know from these conversations that he had with Bob Woodward. We know, even going back to the hydroxychloroquine thing for a second, why did he take it? Leave aside the fact that it didn't work. Why did he do it? Well, maybe he was actually really worried. Maybe he had had contact with somebody at that point, and he's thinking, well, I need to protect myself. So my point is that I think reckoning, I don't know if that's the right word, because I think he has known the seriousness of this for some time. What has now happened is that it's affected him directly, and that is something he can't hide from. They've got to disclose this, which they did. They've got to continue to be fully transparent in terms of his symptoms, and we'll see. We saw what happened with Boris Johnson in the UK after he contracted the disease. We'll have to see what happens with the president in terms of his mindset, not just the physical sort of course that this disease may or may not take for him.
I want to bring in now, Doctor, please stand by. I want to bring in Arlette Saenz. Arlette Saenz is a political correspondent for us here at CNN. She has been covering the former Vice President Joe Biden. Were you traveling with him as well, Arlette? Weren't you?
Well, so I was at the debate on Tuesday night, and also
are you hearing anything from the Biden campaign?
So we have reached out to the Biden campaign to see how they are going to respond to this, to also see how they're feeling about the fact that Joe Biden was sharing that debate stage with President Trump on Tuesday night. We know that the two of them stayed at their podiums on that stage during the debate. We don't know if they had any contact beyond that, or if Biden or his family had any contact with any of the president's guests or aides who were there. But we do know that for the former vice president, the campaign has told us that he is being tested for coronavirus on a weekly basis. And if he were to have coronavirus, they did say that they would tell the public about that. We don't know exactly when the former vice president's last coronavirus test was, but that is occurring on a weekly basis. And you've seen Joe Biden throughout the course of the campaign take these precautions due to the coronavirus pandemic. He very frequently is wearing a mask. The only times he kind of removes it was when he's quite well distanced from people, if he's giving a speech. But that is just one of the things, one of those measures that he has been taking to set an example. Because what Biden has said repeatedly is that we need to listen to the advice of scientists and medical experts and heed things like social distancing and wearing masks. He has repeatedly said and told the American people that if they wore masks, it could help prevent others from becoming infected and also more deaths. And so he has led by example, he has said, by doing that himself. We also know that the staff who is frequently in contact with the former vice president, that they are often tested for coronavirus, the media that has been traveling with him as well. When I've gone to events, every time you have to get your temperature checked and answer a questionnaire relating to COVID. So the campaign on Biden's part has taken a lot of precautions when it comes to the coronavirus. But right now, we are still waiting to hear what their thoughts are about the fact that the president and the first lady and one of his top advisors have now tested positive for COVID-19.
Well, it's interesting because the Biden folks had said that, that the vice president hadn't been able to get out on the campaign trail because he was heeding the policies of social distancing, the wearing masks, the quarantine. He had been heeding that to the guidelines, to the way that he thought it should have been, and to the way, quite frankly, the Trump administration had been saying, adhering to the rules. And the criticism has been from the right and from the president, Joe Biden is stuck in his basement. He won't get out. He's wearing a mask, whatever. Perhaps Joe Biden was doing the right thing, and it's now time for the Trump administration to take a lesson from what the Biden folks have been doing all along.
Well, the Biden campaign has been very resistant to holding these large rallies in the way that the president has. Ever since the coronavirus pandemic really halted campaigning as we know it, basically between March and early June, Biden was not out there doing public events. When he did start holding events, they're much smaller, sometimes just a dozen people maybe in the media. They've kind of started to expand a little bit of their footprint. He had a rally, or he had an event in Johnstown, which was a drive-in rally where people in Johnstown, Pennsylvania, were able to drive up in their cars and sit around outside of their cars, distanced from other people. They really have been trying with their events to show that they are going to listen to the advice of health experts and local officials. They're very cognizant of when they travel to a state, whatever the size gathering limit is, they're very cautious about making sure that they adhere to those standards. And you had heard criticism from the president and his campaign saying that Biden isn't out there doing enough. The president says there aren't people that show up to his events, but the Biden campaign has very intentionally and purposefully made sure that their events are adhering to those safety guidelines that have been put out there by health experts and also the local officials as well. But really, I mean, Biden has repeatedly stressed the importance of wearing masks. And you've heard, even on the debate stage, the president was mocking the former vice president for wearing masks as frequently as he does. But he has repeatedly said that this is a way to help prevent the spread of this virus and has tried to have his campaign lead by example in that way.
Yeah, and they've been doing that since the very beginning. Arlette Saenz, thank you very much. We appreciated getting more information. Please get back to us. We'll get you on the air. I want to bring in now Dr. Lena Wen and also our very own Dr. Sanjay Gupta. This is Dr. Gupta, this is the headline. We learned about this back in January. The country started locking down back in March. The President of the United States has now tested positive for coronavirus after months of downplaying this disease. 207,000 Americans have died from this disease. Hours ago, he said that we were at the end of this pandemic, and here we are with the President of the United States and the First Lady and a member of his staff that we know of now, all testing positive for coronavirus. What a moment.
Yeah. Sorry, I didn't know which doctor you were talking to, but I'll
Dr.
take
Gupta.
that. Yeah, Welcome, Dr. Wen. Good morning. Yeah, no, it is very unsettling. It is stunning, and I also have to say it's not surprising for a couple of reasons. One is, this is a very contagious virus, okay, and the virus doesn't care. The virus doesn't care who you are, doesn't care where you are. It just likes to jump from host to host. But it's also not surprising because it's still stunning to me, I'm sure to Lena as well, that in the highest office in the land, physically, I'm talking about the West Wing, the Oval Office, that there weren't some of the basic precautions being taken place. The precautions that we talk about from a public health standpoint aren't foolproof. They're not, a panacea, but they could have gone a long way towards curbing the spread of this. And as you were just pointing out, along with Brian and Kate and everybody, that there was still a very lax attitude towards this virus within close quarters, close contacts for people that were having meetings, prolonged meetings, all these types of things. That was always a concern. And I think for a lot of people, it was thinking, you're really tempting fate here, with allowing this to continue to go on, especially in an unmasked sort of way. So it's again, very unsettling for people to wake up to this news. Statistically, the president is still likely to have a full recovery from this, very likely to have a full recovery. But this was, I would dare say, it was preventable. What we're seeing right now. Testing doesn't prevent the disease. Testing tells you now have it. People kept saying, well, he's getting tested every day. Well, that's not the point, really. Testing is important because then you can isolate people, but testing doesn't prevent people from developing the disease if they're still not abiding by other public health measures.
Yeah, and that was never the point. And a lot of people confuse that, saying, well, if we just have more testing, that's not going to stop it. But that's not the point of the testing. Yes, it can stop it because then you find out who has it and where, and you get the spread of the coronavirus, and also where there are hot spots and so on. So it can help with containing the virus. Dr. Wen, I asked Dr. excuse me, good morning to you, and thanks for joining us. When last I spoke to you, it was evening. So I asked Dr. Gupta if he thought this was a reckoning. I think a better question is this an opportunity, considering the First Lady says she feels okay, the President says he feels okay, we're understanding that Hope Hicks is suffering symptoms, but is thought that she's going to be okay. Is this an opportunity for the president now to correct course, and to get people to get on board, and to now take it seriously, to tell people to wear masks, to tell people to social distance, to tell people maybe it's not such a good idea to open up all sections of the economy right now, to send all children back to school, that people should not be out hanging in bars and drinking where they won't social distance. Is this an opportunity to have more buy-in from the American public, and that will actually put our economy and the health of the country back on track?
I really hope so, Don. But backing up for a moment, it is going to take time for us to see what's going to happen with the president and first lady. And of course, I am praying for them and thinking about them as well and hope that they'll have a full recovery. But it's going to take time. It's going to take maybe a week or so before they may develop symptoms. And if people were to develop symptoms, between the time they develop symptoms and between the time that they get very ill, we're talking about another week or 2 weeks after that. So we are going to be waiting for a while to see what happens with the president of the United States. But to your point, I hope that this is an opportunity that all of us as Americans will be taking, because we have known for a long time now what it takes for us to prevent this disease. But we've also let our guard down. And in some ways, it's understandable because of quarantine fatigue, also understandable because I think it's hard for us psychologically to think about people we love, our family and friends, as having coronavirus. But there's no face of someone who could have coronavirus. And I think as we're finding out tonight, the president himself could have coronavirus. And maybe that should be a reckoning for all of us to pay attention to this extremely contagious and very serious disease.
What is your advice if you were advising the White House? Let's just say you were one of the people who had the president's ear. What would you tell him?
Well, I would tell the president to be upfront with the American people. I would ask him to give an address directly to the American people and explain about exactly what he is going through. I think this is a moment that he could be connecting with the millions of Americans who have had coronavirus and talk to them. And also, it's an opportunity for him to talk to the American people and explain to them how we can take precautions, we can take matters into our own hands and prevent one another from getting this extremely contagious disease. It's an opportunity to turn things around the way that I really wish the president had done months ago in terms of having a national strategy. But this is a personal moment that he could connect with the American people and help to save many more lives potentially.
All right, doctor, stand by. I want to get back to CNN's Caitlin Collins now. Caitlin, listen, we got the news earlier. Your sources, I had a source as well, telling us about Hope Hicks, that she had tested positive, and we were trying to figure out what's going to happen from there. She was in close contact with the president then admitting that he had heard about it and that he and the First Lady had been tested and they were awaiting their test results. Now we're learning that the President of the United States and the First Lady have both now tested positive for the coronavirus. Again, so many unknowns. We don't know what's going to happen tomorrow when the sun comes up in Washington.
Which is going to be in just a few hours from now, Don. But we're also learning more about how this has transpired, and there are going to be a lot of things that the White House has to answer for, because what we have just learned from sources that I've been speaking with over the last hour or so is that there was a small group of officials inside the White House that Thursday morning knew that Hope Hicks was ill and that she had tested positive for coronavirus. Despite knowing that and knowing that she was someone who was around senior staff on Wednesday, a very late night trip, and around the president still went to New Jersey yesterday for a closed door fundraiser that was inside, despite knowing that he had spent several hours previously on a plane with someone who had tested positive for coronavirus. The other thing that means is that Kayleigh McEnany, the press secretary, was also in close contact with Hicks, yet despite that did not inform reporters today and instead held a press briefing at the White House where she came into the room not wearing a mask and briefed reporters for about 25 minutes, I think is how long the briefing lasted. But of course, as is their style, the White House press secretary and her staff, they do not wear a mask when they're in the room. The White House reporters do wear a mask when they are in the room asking questions of the press secretary. So the question is going to be for the White House, why did the president still go to New Jersey knowing that he could potentially put these people at risk, these people, these donors and fundraisers that he was sitting with at this roundtable today? And of course, why did the press secretary still hold a briefing despite knowing that she had come into contact with someone who had tested positive for coronavirus? And just saying that she had gotten a coronavirus test, she didn't even tell us, didn't even tell the reporters who were on the plane, didn't disclose any of that. And there are going to be serious questions about the White House keeping that information, not just from the reporters in the room, but also from the American people about the state of the health of the president and the people that he potentially came into contact with.
So, Caitlin, just real quick here. If this had not leaked or the media had not found out about it, or as he likes to say, the fake news media, which is, not because we're reporting it, it's not fake, might we have not known about this or heard about it much later?
I think we would have found out eventually. I think it would have been impossible for this White House to have a president who tested positive and not tell anyone. But you have to look at the timing here, because the way the president was speaking to Sean Hannity tonight, he said that he had just been tested. That was around 9 o'clock, about an hour after the story had broken, and said they were waiting on their results. So you have to question, how rigorously are they testing the president? Is it actually on a daily basis? And if they had not tested him tonight, knowing that the public was well aware a top aide had tested positive, what if they had waited another day, Don? What if they had waited until tomorrow before he was going to Orlando, and then the president had still been around his family, other aides, other staffers? There are staffers who work in the residence of the White House, we should note. It's not just people who work in the West Wing and are political focused. There are staffers who work and serve the president and the first family in the residence. So it raises questions about those people, about the Secret Service agents who protect the president and obviously are in close proximity with him. It raises so many questions questions about the people who potentially could have been put at risk because of this and because of a lack of information and being forthcoming coming from the White House until the president himself decided to tweet out his diagnosis.
And there were reporters who were traveling with the president on Air Force One, and they didn't know until they heard the news. So it's just unbelievable. Caitlin, I want you to stand by. I want everyone to stand by. We're going to take a break here, but we're going to continue on with our coverage. Obviously, the breaking news: the President of the United States and the First Lady of the United States both testing positive for the coronavirus. We're back in a moment.